My name is Leslie. I'm a compulsive overeater. I live in Delaware in the United States, and I'm part of the Diamond State Intergroup, which is part of Region 7. I'm going to just be real brief. I have been in OA for 36 years, and I have been coming to World Service Business conferences on and off probably since the 1990s. I think I've attended more than 15, and I always get a real kick out of them. I learn a lot. And currently, I am the delegate co-chair for the PIPO committee. I've been on the committee for 2 years. The PIPO committee is the Public Information and Professional Outreach Committee, and we work with talking to the medical professionals, to do advertising through radio stations, television stations, all of the other types of social media out there like Facebook and Instagram, just as two examples. And we have a really great guide on the website that you can use. And I will put that link into the chat in case you would like to bookmark it. I am going to share my screen and some of the highlights or the things that I think are really important with PIPO. When I'm finished, Sandy will be talking about the 12th step within aspect of it. So let me go ahead and share my screen. When you go to the website that I just shared in chat, this is what you will see. And it's some wonderful links on different things that you can take a look at that are part of OA. There are some really terrific resources, and I am going to share that with you. The first thing I chose to share with everybody is the guidelines for health fair participation. I'm not going to scroll through all of it. Feel free to look at this on your own. It gives you ideas on how to find health fairs in your area, how to prepare, when to prepare, questions that you may need to ask, all kinds of wonderful things that you may need, how to set up a display. And that is something the PIPO committee has a long version of with tons of details. And we are working on a one-page how to do it. And I'm hoping that will be done within the next year and everybody will have access to that. This gives you an idea of what you need to have in your booth and what literature. There's all kinds of wonderful information. The next thing I would like to show you would be the guidelines for professional outreach committees. And its purpose is so that OA groups who want to carry the message, they can get to hospitals, treatment centers, correctional facilities, religious organizations, and so on. And it encourages to stick to the 12 steps and the 12 traditions. This gives you an idea of how to prepare a committee, gives you suggestions on how to make contact with the professionals. I know for myself, all of my medical providers are aware that I am in Overeaters Anonymous, and they have shared with some of their other clients or patients. And I think that has been really exciting. There's some literature that you may want to take with you. There is a packet for professionals, and then you always want to make sure you follow through. It's really important to get the word out to the professionals so that they can support us and they can encourage some of their clients and patients to come and continue whatever food plan or whatever abstinence that they have started. They need to continue it. The next document I'd like to share is the guideline for public information events. This one is more for like speakers, and it could be a fair that's held at a college. It could be in a classroom, it could be an assembly, it could be in a farmer's market even. Sometimes they have that. Sometimes the EAP staff with some employee assistance programs, sometimes they are looking for people to help host an event. And this one, just like the other ones, give you suggestions as to when, as to how, just just like everything else that I have been talking about. So we've got that one. Next, we also have this wonderful trade shows manual, and it has 26 pages, so I'm not going to go through all of that, but I will show you the table of contents. It gives you ideas on how to work at the trade shows because trade shows are typically a lot larger in size than a classroom visit or a health fair. The trade shows can have thousands of people who attend. And what's exciting, with this is there are all kinds of ways or all kinds of things that you can do to be able to participate. And I just wanted to show you the table of contents. This is available to download at no cost. And everything I have shown you so far is available to download at no cost. And you can get that all from the website that I shared earlier. Something that's really important is anonymity. And OA has their statement with Tradition 11 saying, our public relations policy is based on attraction rather than promotion. We need always maintain personal anonymity at the level of press, radio, films, television, and other public media of communication. In 2019, the World Service Business Conference recommended that any OA member group or service body that are using social media for OA public information maintain the personal anonymity of their OA members. Basically, what that is, a member like me is anonymous. OA as an organization is not anonymous. So each member is responsible for maintaining their own anonymity. There are people like myself who, in most places, I'm willing to share that I am in Overeaters Anonymous. Sometimes not, sometimes yes. That's my choice to break my own anonymity. I would not go and break somebody else's. So this is all about the social media policy. And there are many types of digital media. They include email. It's helpful to avoid the use of your full name as part of your email address or to use your business email address. So, like if I am talking to the trustee liaison from my region, I know he has an OA.org email address. And so I know that it's safe and it's not going to break any anonymity. If you're within the fellowship, a lot of people get a second email address. If you're outside the fellowship, you can use your full name in an email, but be careful as to where it's going. That is a choice of yours. Then we also have blogs. If you are mentioning OA, please do not use your full name or photo. If you want to use your name or photo, please do not mention OA or make references that would disclose the membership. For messaging applications, it's pretty much the same thing. Same with podcasts. It's very important to protect your anonymity and anybody else who may be there. I know that on Facebook, there are several private groups, and there, when you join the group, you are asked several questions. And once you are in, you know that only members of this fellowship are going to be joining. So it's a safe place to go and share and not worry about using your full name. That's the same thing with the social networks. We also have to think about copywriting and using OA's name and logo. So the OA, Overeaters Anonymous, and the OA logo are trademarks, and all OA literature is copyrighted. If you want to use it at, say, a workshop or a retreat, you need to get permission from the World Service Office before using it. And there is a form online, and it's also what's here in blue, so that you can ask for that permission. My intergroup has held several retreats and workshops, and we have asked for permission. And most of the time it has been okayed. There have been a couple times where they'll say, we would prefer if you do it, and they'll suggest just a different method. But it's very important that we don't break any copyright issues. And that goes with logos, literature, anything that would go electronic. The next thing I'd like to share is just telling you that there is a pamphlet about anonymity. It's available for $2.25 American. There is also a public information and professional outreach manual that is available for $20. It is a wonderful resource. My region and my local area have been using it and have gotten a lot of really good information from it. So I definitely would suggest that if you want to do a lot of outreach, this would be a great thing to help you with it. OA also has public service announcements, or PSAs. They can be 15 seconds, 30 seconds, 60 seconds. It depends on the radio station or the television station that you may be going to. The different media stations have some requirements. Some want a live copy, some want a live interview. Some will take something that has already been recorded. And these are great ways that we can carry the message. I remember many, many years ago when I was probably in OA about 7 or 8 years, I answered questions at a radio station and I used a fictitious name. I don't remember what it was, but the DJ asked me some questions. I was able to answer and promote OA. At that point, my local area had a telephone number and not a website, if I recall, but I was able to share the telephone number and how to get in touch. And we did get some good response from that. Another time, it wasn't a PSA, but I was asked to share or to be interviewed for a newspaper article. And I think it was either around Easter or Valentine's Day because it had a lot to do with all of the sweet things that people get. And they would not let me use a fictitious name or not a name at all. So I went as Leslie, and I did not mention Overeaters Anonymous or a 12-step program, but I did mention that I had a great support group. I hope that people got something from that, but I knew that I had to do it because I couldn't break my anonymity in the media in that way. It worked out well in the long run. You can call radio stations, you can email them, you can do the same with television stations, talk to the public affairs directors, and there are some pre-made PSAs, public service announcements. And if I have some time and my computer lets me, I will show you at least one. There are so many places that you can go to get great information. In the video resources, there are, I would guess, 10 different types of videos with different lengths. Like this one here is a minute and 15 seconds. This one is about 50 seconds. I'm going to give it a try. I'm not sure if you will be able to hear the narration. It's less than a minute.
Food obsession. It may feel isolating, like no one can relate. We know what that's like at Overeaters Anonymous. When you feel like food has taken over your life, feeling helpless. Should I eat or not eat 24/7? You may feel like you're struggling alone. But real healing and recovery are possible, emotionally, physically, and spiritually. One day at a time, we recover from compulsive eating together. Overeaters Anonymous has your back. The OA community has meetings in person and online, resources, and help for what you're going through. And we're totally anonymous, so you can just be yourself. You are not alone. Visit OA.org today.
That's just an example of one of the videos, and there are quite a few. There are also posters available that can be printed out and put up, like this blue one here with the fork. There are just so many different options. I'm going to stop sharing here, but the other things I would like to talk about is that when you are reaching out to the professionals, to the public, make sure that you have extra literature available. Make sure that the group that is sponsoring the event has people in attendance who are experienced, who have been abstinent. It could be a year, it could be 10 years, it could be longer, but that way, anybody who is coming to and wants to speak to you, they will be able to hear your hope. They'll hear your recovery. And those are some of the important things. Make sure that you're patient. Just because, let's say, my group did an event on May 1st, it doesn't mean that my group is going to start getting responses on May 2nd. It could take till June. It could take till July for that notion to hit and say, yeah, I think that might be a good place for me. That's kind of what happened with me. I was in college. I saw a flyer in the dorm, and it was probably a couple weeks later until when I was with a friend who said she was going to a meeting, and I joined her because the timing just seemed to be right. There's also some really good literature that you can print or purchase. One of the really nice ones that I know I can say my intergroup is using right now is called What to Remember When You See Your Doctor or Other Healthcare Professional. It has a lot of really good information on how OA works, how the 12-step work. You can add your own local information, whether it's a telephone number or a website. Make sure that you have people who are willing to answer emails. Make sure that you have people who are willing to take phone calls. For myself, I've always been willing. This organization has made me a totally different person than I was when I came in 30 plus years ago. When I came in, I was angry. I was miserable. I was hurting. And today, I'm not angry. I'm not miserable. I hurt differently. I hurt physically, but not emotionally like I did in the past. Things are so much different. I have a more positive outlook on life. I weigh less than I did in the past. I'm less shy. It's definitely made a huge difference on how I look at myself and how I look at others. I've learned how to be a sponsee, how to sponsor, and I do both. I am willing to share my experience ever I find that it's appropriate, that I won't break anybody else's anonymity, that I can share how the steps have changed my life. I use them in my daily going on because they're important to me. I'm not at that point where it says in the steps, the computer didn't work, the car broke down, and so on. This morning, my computer didn't work. And I'm like, I may have to get on the tablet for briefly, but I figured it out and it's all good. And that's what's important. My car broke down about a month ago. My first thought was, oh crap. And it was in that kind of mood. It wasn't miserable. It was like, okay, let's see what you can do. To me, that's just applying the steps in my daily life. So I hope this was helpful. I hope you got some good resources, some good information. Feel free to contact people from the PIPO committee, the Public Information and Professional Outreach Committee.
Oh, you can just hire someone to do that for you. And it was relatively inexpensive, and we didn't have to do all the footwork or try to find out who to contact or because the person we hired had all that information.